Hello, this is Dr. Brian Heaberlin here with Lexington ENT and Allergy, and I want to talk about nosebleeds today. Obviously, nosebleeds are a common problem, and in most situations, they're really not that serious, but there can be very serious nosebleeds. As an ear, nose, and throat doctor, I sometimes have to take people to the operating room or do certain procedures to stop nosebleeds that won't stop on their own. So what can you do at home if you get a nosebleed? Well, most nosebleeds are caused by small vessels that are in the front of the nose on the septum. And the septum is the center divider that runs from the front to the back of the nose and separates the right and left half of the nose. In the very front, about a half an inch inside the nose, the vessels are very close to the surface of the nasal passageway. And it's very easy for those little vessels to kind of crack open and bleed, especially if there's a little raw area in that part of the septum. And that can create a nosebleed, and those nosebleeds can be rather heavy. Most nosebleeds will stop on their own. A little pressure can help. So sometimes pinching the nose, people talk about either leaning the head back or forward. It really doesn't matter too much. Forward's going to keep it from draining down your throat. Backwards you may not see the blood, but it's still coming out if you're still feeling that there is still bleeding present. If you do just pinch your nose, you need to hold it for probably 10 minutes before you stop. So some people just stop too soon on the pinching and they'll keep opening it up and the blood vessels just kind of keep on happening. I think a better solution is to use a little rolled up piece of tissue, especially if you can soak it with a decongestant spray like Afrin. So I have people take a small tissue and roll it up into a little ball and then just wad that tissue up into something about as big as the last joint of your pinky finger, and then have them saturate that with some Afrin. So Afrin nasal spray, we don't really like people to use Afrin nasal spray, but this is one exception. But Afrin nasal spray saturated on that little pack and then stick that all the way up the nose. That pack will put pressure on those vessels. The Afrin causes the blood vessels in the nose to constrict, which makes less blood flow come out, and then one slows the blood flow, and it also gives it a better opportunity to clot. And then leave that there for a few minutes. Once you know that it's nice and stopped, probably 30 minutes or so, you can slide that pack out and then put some Vaseline in the nose. So Vaseline is an excellent moisturizer for the nose. Now you don't want to put a lot, but you want to put a little glob of Vaseline in the nose. So you can just kind of smear it up the nostril and then just pinch to rub it around, and that'll put a coating of Vaseline on those raw areas, and that'll give it a better opportunity to heal. If that doesn't work and it's heavy bleeding, you may need to go to the emergency room. In the emergency room, they'll often put some balloon style packs in, or they may try to cauterize it. What do we mean by cautery? So we can sometimes use these little matchstick looking things called silver nitrate, and that'll sort of seal and burn the vessel a little bit. Now it sounds like that would hurt a lot, but really it's just a small chemical burn. Usually we can put some numbing medication in the nose that'll make you hardly feel that. And that'll usually do a pretty good job about stopping nosebleeds that won't stop on their own. Sometimes that doesn't work, so it's very much a stepwise process to try to manage some of these more severe nosebleeds. But you can do most of this on your own with a little Afrin soaked pack, and that'll allow it to stop. And then you may have some off again, on again bleeds for a few days, but hopefully if you keep the moisturizer going with Vaseline, that area will heal and then it'll go away and it'll stay away. If you're having a lot of ear, nose, and throat complaints, nosebleeds, nasal congestion, stuffiness, come see us here at Lexington ENT and Allergy. Sometimes recurrent nosebleeds can happen because the septum is crooked, and sometimes a septoplasty, especially if someone has a lot of nasal congestion problems, can really help alleviate these problems once and for all.